the Gillingham Community Mental Health Team are actually changing student practice for the better by allowing students to actually listen to service users and to learn from them, thus enabling them to go forward and use their experiences in practice.
The buddy scheme is so simple. It's two people sitting down together in an equal partnership. We knew that mentoring was already validated in nursing education, so it really seemed a simple concept. Why shouldn't service users become mentors to students who were on practice placement with us at Gillingham Community Mental Health Team?
My friends valued me. I mean, I had good friends, I still have now, but I think because I became more withdrawn from them and we were sort of interacting.
The buddy scheme really stood out because it seemed to us that it, in a sense, is a very simple idea. It's about people who really know what mental health is about, because they're people with direct experience of mental health distress, acting as mentors or buddies to people training in health professions.
I don't think I could have gained this experience from any textbook or any lecturers really from university.
One of the things that we emphasise to the students is that when they're with a buddy, it is a pure learning experience.
It's not about the illness in mental illness, but it's about the person, and that person is a person in their own mind who have a life to lead.
From textbooks, it doesn't really give you the other side. It only gives you a very negative perspective at times.
Service users come to it also with a different perspective because they're not being assessed. So you learn a lot more about the experience of it. Even as a professional who's worked for now 10 years, I've learned a lot more about the experience of service users within a service because they're questions we don't ask.
I think it's helped in my recovery, and it's given me more confidence in talking to people and working with people, because I give the students an induction to the buddy scheme, and that means I sit down and talk to the student for sometimes up to an hour. So it's definitely improved my confidence and people skills.
I think the buddy scheme can help enormously in the education professionals because it's really the only way one has of teaching people the empathic, the emotional side of experiencing mental illness, what I think the social workers call the lived experience.
It's lovely. I tell you what I like about talking about the buddy scheme, because it takes me back to my my illness. You know, I mean, I don't think about my illness on an everyday basis. I only think about it when I talk about it, like to yourselves. And when I
see the future of integrated mental health services as being partnerships with users of services and carers who support users of services in the future. I think it's an absolute central principle, these sorts of schemes, in allowing this trust to deliver better services, make those services more user-friendly to people who experience mental health problems, reduce stigma and prejudice in the community about people who suffer mental health illnesses, and really focus on people's recovery.
Some people, they're very sensitive, you know, and they get very emotional sometimes over things we say, you know, which is a good thing really, because it brings out understanding what we're teaching them, you know. So,
it's broken down the barrier between the professional and the patient and giving it more of an equal relationship.